are back with David Carroll, a physical therapist with Cone Health Outpatient Rehab at Drawbridge Parkway, and we're talking about health after an injury. So kind of walk us through what a safe, structured recovery program might look like at Sagewell for someone with a back or a knee pain.
Yeah, so we'll talk about back pain because that's a frequent one that we see. What we do is when you first came in, we'd want to know, is this something that just happened? Did you just pick something up and you hurt your back, or is this kind of a long-standing issue? After we've kind of established that, what we'll really look at is, is it, how bad is it? I mean, can you not walk, or is it something that flares up every once in a while? Then generally what we'll do is we'll look for some type of movement pattern. So with majority of people with the back pain, it's going to feel good to either bend forward or bend back. So we kind of look and see which one of those movement patterns that you fall into. Usually on the first day, I try to give people something that's going to make them feel a little bit better. So if you have back pain, we want to establish that base of something you can do to kind of change that pain level. Once we have that, that's when we start to kind of figure out what your goals are, where you want to be. The best exercise that you can do is the one that you're most likely to do. So we want to kind of find what you think that you're gonna be able to do over a period of time. Once we establish an exercise program, with the back, we're really looking at core stability, hip strength, posture, things like that. So we're really trying to establish a program that you can do over a period of time. With back pain, especially, we really want you to think down the road. Once you come to physical therapy for your back, we want you to feel like a year down the road, if your back starts to hurt again, you have the tools and ability to be able to kind of take care of your back. So,
How about a few don'ts, exercise don'ts, for that very common thing of that back pain?
yeah, with back pain, the only two exercises I kind of try to steer people away from are like a loaded flexion, like abdominal work, or loaded extension. Loading up your spine and then kind of crunching it in end range isn't the best thing. Other than that, I mean, every exercise, if we keep good posture and we breathe correctly, every exercise can be a good back exercise. So really, again, it comes down to what you like to do and what you don't like to do, and really listening to your body. It's gonna tell you if it likes it or not. Muscle burn is good. Yeah,
For sure.
muscle burn is good. Soreness in the back isn't good. So you just want to kind of listen
Okay.
to it.
We've got about 1 minute left. Can we talk a little bit about the impact that exercise has on a person's mental wellness and health journey?
Yeah, there's tons of research out there on how exercise affects anxiety and stress, and so they can play a huge role and factor. The other thing I like to tell people is, especially here at Sagewell, you start to develop a sense of community. So it gets you out of your house. You're going to see similar people every day. A lot of friendships start to form and stuff like that, and that can play a huge role in pain and fitness.
All right, and real quick, if someone wants to learn more about Cone Health, Sagewell Health and Fitness.
Yeah, we have two branches right now, and we're trying to expand beyond that as we go along here. We have a branch in Eden and our branch here at Drawbridge. We have a program here called the Right Start program, which is 9 weeks. It usually costs non-members about $99, and that's group fitness, but it's small group fitness with a trainer. So a really great way to kind of get your foot in the door, kind of have a ability to kind of try it out and see if it's something that you like.
Gotcha.
We also have cooking classes and things like that here, which are really fun. Great way to learn about kind of your general health.
All right,
So,
well, thank you for your time and expertise. We so
yeah,
appreciate it. If you missed any of
thank you
this,
very
this is
much.
going to be in the To Your Wellbeing section of our website. Hey,